organization. So this session is just meant to be a place where we get to highlight really awesome women who are working in healthcare and kind of let them talk about their story, the things they're doing and they're passionate about. And I think it's a great opportunity just to kind of hear from somebody who is on a similar path to you, kind of figuring out how to navigate those things. So today, our speaker is Dr. Faith Ibu. She is a medical doctor who earned her MBBS degree from the College of Medicine at the University of Lagos, where she graduated as the overall best graduating student in 2018 and received multiple awards for excellence in medicine, pediatrics, and surgery. Through her work as a physician in various settings, Dr. Faith has gained diverse experience, notably in Nigeria, where she hails from, and from the United States, where she's completing her emergency medicine residency at the University of Missouri in Columbia. Dr. Faith is passionate about international medicine and medical education. In addition to her clinical work, she's an ECHO coordinator with the Continuing Medical Education Solutions Program with Techies Without Borders, like I just mentioned. And in this role, she helps provide educational materials to healthcare workers in underserved regions. She's been involved in several medical outreach initiatives to underserved populations and hopes to develop lasting relationships that foster healthcare growth and development in these regions. She'll be starting a fellowship in emergency medical services at the Mayo Clinic in Minnesota in July of this year to help achieve her goal of developing strong pre-hospital care systems, especially in developing countries. So without further ado, it is my privilege to introduce Dr. Faith.
Hi, thank you so much for that warm introduction. My name is Faith, like you said. I'm going to be sharing a few slides. That's okay. Let's see if I can get this to work well. Can you see my slide okay?
Yep.
Okay. All right, that's great. So this is I'll just be talking about my own process really to finding, meaning in life and in medicine, essentially. So like you said, some things about me, especially as relates to all of us here. I'm currently a resident doctor. I'm in my third year of emergency medicine training. We'll be finishing in a couple of months. Excited about that. And then regarding, my global health work, I also, yes, I work with the Techies Without Borders as an echo coordinator, helping to, write out the summaries of some meetings that we have, educational meetings, and provide that education to, healthcare workers. I also serve as like a faculty mentor in a way to Emergency Medicine Interest Group Nigeria. I'll talk a little bit more about that group later in the talk. And EMRA is like the Residents Association of like all emergency medicine residents in the US. That's like the organization. And I also serve as my programs representative to that organization. And I'm a future aspiring or almost to be EMS physician. Um, I'll be talking today about, something that's really like something I'm really passionate about, something that means a lot to me, and it's really the global emergency care gap. I was born and raised in Nigeria, and that's where I went to medical school. That's where I practiced for a few years before moving down here. And something that was very evident to me was, a lot of gaps in providing emergency care. We know that emergencies occur daily. These are things that are unpredictable. And, as a healthcare system, it's really important that we are ready to help people at the point when they most need it, when they can make an appointment or they can call ahead to say, oh, I'm going to have a heart attack at 10 a.m. on this day. So we just kind of have to be ready to meet things as they come. Um, and training and like growing up in kind of a lower middle income country like Nigeria is, it's kind of obvious that there's a disproportionate burden of illnesses, especially when you compare that to the capacity of the healthcare system to care for that, for that burden. And we're kind of in a situation where you still have a lot of infectious diseases going on. So you still have your malaria, your diarrhea, your sepsis, your pneumonias, and then you still have the rise of, more non-communicable diseases like, cardiovascular emergency, stroke. So that's kind of like, double burden of disease kind of in these places. And there's a lot of challenges that happen with the system. So both in the hospital and outside of the hospital, there's a lot of work that needs to be done to, especially in the area. And I want to emphasize, especially when it comes to emergency care, it's just not as developed as you will see in some other countries. And to be fair, emergency medicine as a specialty, it's really only about 50 years or so, or just a little over that. So there's kind of a lot of catching up that many places have to do to kind of make that a robust system. I would say, especially like in Nigeria, and I'm sorry, I'm going to be talking a lot more about Nigeria because that's where I have more experience. It's more, like maybe out of 36 states, maybe 3 or 4 states have some pre-hospital system, and the others just don't. Like you just find your way to the hospital however you can. Um, and I'll talk a little bit more about some of the challenges too. So even when it comes to in the hospital, because you don't have emergency medicine trained doctors, you have like some limitation in the quality of emergency care that's been provided. You also have limited staff, even when it comes to nurses and aides, limited resources, and a lot of insurance plans are not now it's getting better, which I'm grateful for. But it before people nobody had insurance plans, so essentially you had to come with cash to the hospital. You had to have money to come to the hospital to be able to pay for emergency care, which as you can imagine puts a lot of strain because people are like calling all their family members and like, I'm in the hospital, I need money, and that's just not how you want to help, in the case of an emergency. So there's a lot of opportunities for growth, and this doesn't just apply to Nigeria. I like to say that even in the US, there are like, rural areas that don't have as much access to care as some other places. And that's to talk about other parts of the world too. Lots of places we just kind of need to keep bridging that global emergency care gap to ensure that everyone, anywhere they are, have access to emergency care. So some priorities or the ways that I like to think about, emergency care development and areas that need to be developed. Essentially, I'll start from like the bottom of this pyramid is really strengthening the acute care system. So that comes from like infrastructure and, like staffing and just resources and having things available. And this might mean, building more hospitals, having urgent cares or, like first aid stations. I like to think about them like just a place where someone that is qualified to like deal with certain emergencies can meet those needs. So strengthening those acute care systems. And then another aspect of this is empowering communities because I think that it's really important that people know what emergencies are. I remember, like I remember several situations where something's happened and everybody's like, oh, what do we do? Or people come to the hospital like days after something has happened, like you're like, oh, I think you had a stroke like a week ago, but you didn't know. So you just kind of like stayed there and waited. So just empowering with the knowledge, I think is really important to first recognize what emergencies are, first aid training on how to address, things like choking or, bleeding or someone's having a seizure, how do I, position them and not do and like prevent there's some harmful practices that people have done over the years just because they don't know what to do. And just that education, I think, would really make a difference. And then not to even talk of CPR. I mean, bystander CPR is just such important training that, saves a lot of lives when the community is empowered to do it. And then another aspect of this would be enhancing access to care. So that's like trying to overcome geographic and financial barriers. So geographic barriers would be, making sure that people are kind of within a reasonable distance. So I practice in like different settings in Nigeria. So I grew up in Lagos, which is more like a big city. Most people can get to a hospital, within an I mean, while they're physically within an hour, because it's also a big city, there's a lot of traffic. So I would say it might still take a few hours. But then I also practice like in a rural place where a lot of times people like have to take 4 hours to get to where they're going. And sometimes it's because they're going on foot, they don't have any means of transportation. And even when they get to one center, they just have very limited care at that center. And before they get to the specialist center, it's another 4 hours. So it's kind of like a lot of barriers and a lot of things that could have been taken care of along that way. You can imagine that this leads to, preventable deaths and preventable morbidities. Um, So just, intentionally like improving that access to care, something that would be very important. Then promoting the quality of care. Of course, we just don't want to say that we have hospitals or we have facilities. We want to ensure that we're providing the best quality. We're doing it based on, the biggest available evidence that we have. And then this kind of leads into the next one, research-driven solutions. And this is kind of prioritizing research. Many times when, I try or you try to get data, especially like in lower middle income countries, you realize there's not just as much data available on exactly what the situation is, what is going on, and that limits your solutions because it's like, I don't know what's happening. I don't know how to help. I don't know how to bridge that gap. So just like a focus on just even collecting the data is a great place to start from. So these are some ways to prioritize, developing healthcare. Oh, sorry. Oh, I'm sorry. My computer has been Anyway, so those are some of so I would say these are some of the ways that I think about, emergency care development and how I want to help, you know, address one of these areas in developing emergency care. And this is, part of my work with Without Borders, like Michaela said earlier, is, this continuing medical education solutions and the echo project where we kind of host sessions that teach people how to deal with several kinds of emergencies. So it could be dealing with sepsis or rheumatologic emergencies or cardiovascular emergencies where you have experts talk about this and kind of like, and I love these sessions because it goes in such a like systematic way on there's like a case presentation, or this is how someone would present like this, and then you go through how do you evaluate, how do you manage. And one of my main role there is to take these videos and make them into like documents, because not everyone's able to attend the sessions, but then you have like a document that you can reference and say, okay, like wherever you are, you're like, well, I'm on shift and I'm seeing this, you can reference that document and say, this is what I need to do. So I think that this is a great organization and putting out a lot of education out there. They also have journal club sessions where people can just kind of talk through papers and try to keep up on the evidence, like we said, providing quality care. And then some other things that I've done in the past, in line with kind of my goals or passion, I would say, is stop the bleed training in Nigeria. So I was able to go back. It's been a couple of years now, but like in August of 23, we held this like stop the bleed training for so the people in the middle picture, these are like road safety officials. And because like I said earlier, there's no well-established, like pre-hospital systems or EMTs or paramedics. So a lot of times people get first aid by whoever just happens to be there. So like some bystander is able to provide first aid, and then road safety officials are usually on the road trying to, direct traffic and make sure things are going okay. So many times they tend to witness, when it comes to road traffic accidents, they tend to be the first on scene. So that's why we thought that they were a good target population, to kind of train on this. And they were really excited, to be honest. They were like, oh, now I don't feel as helpless as I did before. I actually know something on how to like stop threatening bleeding when it does happen. And then this other picture was also, these were medical students, actually. These were medical students at the school that I graduated from that were also like, oh, you're coming to teach this. Why don't you teach us as well? So that we know, we also know what we're doing. So it was good. I mean, we didn't have as many. So we had like just like this one tourniquet, and then we used like pool noodles to kind of simulate like bleeding, and it was kind of innovative and fun. But essentially, I think that this is, basic, and I think that this training should be for everybody, like, bystanders, and it's just really helpful for people to know what to do when they see, massive hemorrhage. Um, and the other then another organization that I've worked with as well is Global First Responders. And this is so the first picture here. This man on the left, he's an attending at my hospital actually. or at my program, and he owns this organization. Started it a few years ago, and she's also an attending. And essentially, he just takes doctors from wherever, from the U.S. mostly, to places all over the world. I mean, they've been to so many countries, and all they what they do is kind of like try to establish, medical care. So it's almost like it's like a week long of providing medical care to people in a certain community. So people come, you kind of do counseling, you provide medications, you provide recommendations. And what I love about this organization too is they also try to establish a relationship with that community. So it's not just, oh, I'm coming and I'm giving you this bag of meds for like, 3 days. Like, I mean, what happens after that? But also trying to like do some, we like when I went on this trip, this was to the Philippines, and which is such a beautiful place, to be honest. It's such a beautiful place. Look at that. Just look at that beach. Anyways, this was one of the islands, and this was one of the more remote islands where they essentially had to like travel across the water like an hour before they got to like a tertiary facility. So one thing that did or I enjoyed doing with this organization was trying to talk to the doctors that are there, and like, what are the challenges? Like, how can we actually help like long term, and trying to establish relationships where there's like exchange of knowledge and exchange of resources, to ensure that we're actually developing these communities and not just doing a one-time thing. And that's what I truly like about this organization, because, there's that continuing um, effort with them. So moving forward for me, so I will be finishing my emergency medicine residency in June, and I'll be going to Mayo Clinic for EMS fellowship. And that's because when I think about emergency care and my overall goal of helping to develop, better systems, like in Nigeria, where I'm from, and just in, other lower middle income countries that still have underdeveloped systems, I think that I just kind of get overwhelmed because I'm like, like we talked about that pyramid, there's so many things that can be done. So I just picked EMS as my own niche because I feel like, first of all, that's a place that needs a lot of development. And it's also a really, really important point. It's like that transition between when this emergency happens and like when they eventually get to the hospital, what happens in between there? Like, how do we ensure that the community is empowered to provide first aid? How do we train paramedics and train EMTs to make sure that they're providing good quality care as well? So that's kind of like my niche, or hoping to be that's the niche I'm developing because that's the area I want to contribute the most. I'm working with several of these organizations. Econ is an organization in Nigeria that provides BLS, ACLS training, point of care ultrasound training, to healthcare providers. And Eight Medical it's a private ambulance system, but it's a good one, that is trying to like expand care because the state-owned ambulance system is really limited in its coverage right now. So there's a huge part of the population, especially in Lagos State, that is just not served by ambulance coverage. So this organization is trying to bridge that gap. And in doing that, it's just a lot of work that needs to be done. Like I said, training of the paramedics and all that. So that's kind of what I'm working with them on. And then IMIG, again, I'll talk about that, I think, in a couple of slides from now. So essentially, my goal is to build partnerships with local stakeholders, help train trainers, create like sustainable knowledge transfer. Like every time I get training, I'm thinking, how can I train someone else? How can I pass this on to the next person that improves the next person? Because when you create that chain, you really cannot measure the impact because someone's life might be saved somewhere by one thing, random thing that they heard you say or that you happen to tell them 4 years ago, and then, help develop infrastructure. And that's another thing I love about Techies Without Borders because it's like, it's creating like a knowledge base that is, mobile and is going to people that you might not essentially be able to give like physical structures to, but you're giving a lot of resources that is very helpful. And then trying to measure that impact, trying to do some research throughout my career. Um, so that's where I'm going. And then I wanted to talk a little bit about where I'm coming from. So I think I've said this. I'm from Nigeria. I grew up in like Lagos, which is kind of like a big city. I'm the first of five children, actually. And I have four, like three brothers and a sister. So this is me when I was about five or so. And that's when I decided that I wanted to be a doctor. People ask me, how did you decide? And I'm like, I think that my parents may have planted a bug in my ear. I'm not exactly sure because I just know for some reason that this was what I wanted to do. And that's my mom in the next picture. And I put our picture there together because when it comes to, women that inspire me, she's like number one. Like she has pushed me my entire life. And it's almost like she just keeps whispering in your ear, you can do better. Like you have to be the best. You have to keep trying. You have to keep going. And she's just always that voice of, like courage. Like even if I'm like, I don't know if I can do this, I'm like, my mother said I can do it. I probably can, and that's just really been something that's, helped me throughout life. And I went to high school in Lagos, and then I went to the College of Medicine, University of Lagos, for medical school, which is like a 6-year training program. I mean, it's not the same anywhere, but that's what I did. And then I eventually graduated in 2018. And it's interesting because, when you're in your clinical years, like which for us was basically from fourth year to sixth year, everybody keeps asking, what do you want to do? What do you want to do with your life? And I'm like, and I mean, I was going through all of the rotations. So, like, there's medicine, surgery, all of the rotations. And I just kept feeling like when I'm at one rotation, I'm like, I really like this. And then I moved to the next one. I also like this. And it was just almost like I was in this constant state of like not being able to decide which of them I wanted. And we did have like an emergency room. And while you're in each of those specialties, you would work in the emergency room. But the unique thing about Nigeria, at least at that time, emergency medicine was recognized as a specialty in 2019. So when I was in school, it did not exist. I did not know that it was a specialty. So I couldn't like conceive of it as like a future career. So I just kept going round and round and getting confused. And even at the time I graduated, I still didn't know what I wanted to do. And something that really changed the game for me or changed the ball for me is some physicians that are Nigerians that are here in the US decided to do a basic emergency care course, which is a great course. It's a course that is developed by the WHO to, part of strengthening emergency care systems in, countries that have underdeveloped systems. So they came as WHO facilitators to do that training at the school that I trained. And that's where they came and said, oh, we're emergency doctors. And we're like, what? Is that a thing? Like your emergency doctors? And that's kind of where the book started. And we're like, and then a couple of friends and I who now started like going in. So this is actually a specialty. So we started to kind of research about it, like see the countries that had it. Started, and we're like, I think that this just fits, right? I feel like I get to do everything that I want to do, like all of the specialties, and I get to do the exciting part. I get to, I was like, this just sounds so perfect, and then we were like, okay, how many people don't even know about this? And then we started this, we wrote this paper, we did this research where we kind of like surveyed all the Nigerian medical students and tried to see if people, and obviously we realized we were not alone. Most people didn't know that there was a specialty called emergency medicine. They didn't know what it was about, but they seemed very interested to learn about it. And that kind of led to the birth of the Emergency Medicine Interest Group Nigeria. And as part of that group, essentially, we just like gathered Nigerian students together and said, oh, this is what the specialty is. We would get like, specialists from like different countries to talk about exactly what the job was like, what their life was like, how to get there. And that was kind of how I got, got into this specialty. And I call this like breaking those barriers because for me the biggest barrier to getting into where I am was even just knowing about it, which is why I'm like also really passionate about like going back to different places and you say okay, these systems are not developed. It's probably because somebody doesn't know that it should be like this, or somebody doesn't know that there's a better way to do this. And everybody's doing their best where they are. But that's why it's so great that the world is a global village now because we're able to all exchange knowledge across and develop better. So with the Emergency Medicine Interest Group, that was kind of like the place where I started to develop mentorships as well, because through that organization, I started to meet a lot of people, or I started to reach out, I should say, to a lot of people in emergency medicine, just saying, oh, this is who I am. I'm really interested in the specialty, but I don't know what to do. Yeah, I don't know how to get there. And that's where, all of the process started, of, getting, and then I started to explore all the options, like looking at countries and all the places that offered emergency medicine, and eventually settled on coming to the US and wrote the exams. And that's where like accessible training too is important too, because when I was trying to march into the US, I didn't know anybody, actually, like anybody that had graduated from Nigeria or Nigerian medical schools that had gotten into emergency medicine in the US. So it really was like trying to like figure out my own way or chart my own course. Yes, a lot of people were helpful, but nobody had the exact same journey. So it made it a little difficult to provide specific advice. But that was where I gathered you know, all of my courage to say, I'm going to do this regardless. And I'm going to just keep trying and do all the things that are necessary to get there. And thankfully, I was able to match here at the University of Missouri. This is my wonderful class. And this is like, this is our trauma room or our resuscitation room where a lot of learning has gone on over the last few years. I see this and I'm just like, I'm kind of sad a little that I'm going to be leaving here soon, but it's been a great training for me. And I'm just really excited about, moving on to just even specializing further in pre-hospital care and able to take that knowledge and, take it back home and take it back to other people that would like to learn and grow. And thinking about this, I just thought about like creating your story, like deciding, okay, what exactly your story would want to be. Because I remember thinking about this. I remember when I made the decision, because when I first said, okay, I think I'm going to be an emergency doctor. I think I want to do this. This sounds great. This sounds like everything I want in medicine. But at that time, when I spoke to a few people, and they were like, "Ah, I don't think anybody has really done this." And maybe some of you may know or may not know, but there were some things that were barriers to getting here because you had to have like, clinical experience in the US. I'd never left Nigeria, clinical experience in the US and get some like SLOEs, which are like specialized letter of recommendations. You can only get when you're here. And, just all of these different things that I had no idea how I was going to be able to get. And then someone was like, what do you want your story to be? And that had such a huge impact on me because I was just like, okay, what do I want my story to be like? I've gone this far, and it helped me think about, all of the things that had gotten me to where I was. And that's like thinking about, the influence of my mom, my siblings, my background, how I decided to go into medicine and what I wanted to do with medicine. And that really like crafted it. Essentially, I decided what I wanted the story to be, and then I just made it happen in that sense. Like I put experiences or I took actions that essentially like create how do I say this? I'm sorry. That essentially like came alive based on like the story I so for example, I was saying something like, okay, I want to be able to say that, or I have, researched this, I have volunteered in this, I have done this, I have done that, and that has formed my interest. So at the time I was thinking about it, I hadn't done any of those things. So like thinking that that was the story I wanted to be able to tell a year from now. So I just decided to take all those steps to be able to tell that story. And the reason why I think that this is also really important is because regardless of whatever healthcare career you're in, or, whatever, I don't think this is just healthcare, honestly. It's just like whatever thing that you're doing. It's important to actually think about what story you want to tell about your journey, because that helps you now do the things that you should be doing. It's almost like because a lot of times when you apply for a job, you have to write a cover letter. You're applying for maybe an educational program, you have to write like a personal statement, or even if it's just, like an elevator pitch, someone asks you, tell me about yourself in the next 1 to 2 minutes. Like if you have thought about yourself or who yourself is, what your story is, that makes it a lot easier to put yourself in best light possible, even if your opportunity is just a couple of minutes, 3 minutes, 5 minutes, and then you're just able to say all of that. And then people are able to get get a good idea of who you are, and they're able to afford you those opportunities that you probably otherwise would not have had if you didn't have a handle on, what exactly you're looking for. I think one way to think about that story is like, what do you feel like your calling is? Like, what do you feel like you want to do in this world? And identifying your skills. Because I also think I like to say this because I think it's really important that your skills align with what you want to do. Like, you shouldn't necessarily be doing something that you're not good at or something that you don't know that you can get better at. Because, of course, we're not all good at things when we start doing them. But something that like you're passionate about getting better at, and you're going to do the work involved, and then something like just align those three things, or like your calling, your skills, your passion, and then craft that into the place that you want to go, and then just start living it out so that whenever someone asks you, even if you're like out of a dead sleep, tell me about yourself, you just like rattle it off. It's just like 3 minutes of like, this is who I am and this is what I want to do. Okay. And this just kind of also led me, because as much as like I'm kind of like coming to the end of my residency training, I'm also moving on to fellowship. And it's also a period for me to be kind of like reflective on like where I've come from and like how I want to move forward. And some of the three things that I think that are essential to just any growth process is really developing your mindset, taking some steps, and then building a network. So that mindset is, there are always these thoughts like, am I sure I can do this? Or like limiting beliefs that we need to get rid of. I think that especially as women, we are faced by not just like the internal thoughts of like, am I sure like I'm good enough for this position? But like, the society also tells you that you're not as good as the other person. And it's important to like take away those thoughts. And I saw the video recently where someone was saying, whenever you walk into a room or you're, going to attack a task or going to do something, like think about all the people that have praised you. So like don't take any negative thoughts. So just like think about, your mom. For me now, it's my mom. Or like think about your mom, your grandmother, that uncle that said, you're the best at this thing, or that one teacher that, like recognized your skill in a certain area. So you just take all the positive things and just like put them together, ignore the negative things, and then just like use that to challenge yourself and recognize your wins. And I mean, always embracing a growth perspective. So I'm not going to be good at everything. I'm going to fail at some things, and that's okay as long as I grow from that experience. And then the actions would be kind of building resilience. That means regardless of however many times you fall, or, like the mistakes that you make, you just kind of find a way to always get back up. I think that that's like an essential life skill, like just resilience, getting better through. And then you build resilience by practice. If you've never really failed before, then you don't really know how to be resilient, or how to grow through that. And then I think it's also important to commit to continuous learning. So that's essentially making sure, and committing to continuous learning, you can build that into a routine. So essentially ensuring that there are things in your life or ways in your life that you're continuously growing. So whether that's like, oh, I'm listening to educational, materials, or I'm attending these meetings to ensure that I'm, getting better at the job that I am doing. And it's easy to do that when you're in training, because you're in a structured environment and people are always telling you what to learn and what to do. But I think that it's important to just have that and build it into our lives, even after training, to ensure that, we're doing this in our daily practice. And then building a network is really, really important, cultivating like professional relationships, people that, colleagues that have similar goals as you have. And then also finding mentors. So when you find people that seem to be where you want to go, like reaching out to them. And this could be like, mentors in different aspects of your life, because we have a different things that we do with our lives. So finding mentors for all of those areas and trying to establish relationships. Finding mentors, and it's not necessarily easy, because you try to reach out, like especially when you're just reaching out to people, not everybody responds to you in the same way, but you just keep trying until you find someone that is willing to, take you on and mentor you through the process. And it's also like you might get different things from different people. So for example, when I was trying to, apply to emergency medicine, and I didn't know much about the specialty. I honestly cannot count how many people I spoke to. I mean, it was just a lot. I just kept emailing people and just getting different bits and pieces of information from different people because, people are busy, they have their lives. So not often would you find one person that can, give you everything that you need. So you just need to take them from like different spots. Um, and one way that is helpful too is like join communities, get involved. Like when you see opportunities, just, jump on them if you feel like this is somewhat in line with your goals and it's going to help your career. And you can also develop other skills. So it might not necessarily be, oh, I'm learning medicine in this, but oh, I'm learning how to be a leader, or I'm learning how to be better organized. I'm learning how to write emails even. Like whatever skill that you get, you usually get that from being involved in communities and organizations. So that would be something that would be good. So this is my conclusion. It's kind of be the hero of your own story, kind of define where you want to go, who you want to be. And I mean, and this looks different to everybody. So whatever it is that you want, that's great. Just kind of like make sure that you're, you know, challenging yourself a little bit, pushing yourself to be a better version of yourself. And especially as us healthcare providers, where medicine is constantly changing, we have to make sure that we are on top of our game and we're providing the best care, to the people that we have, that we serve, making sure we're reflecting on our journey, trying to be better at every point in time. And that's all I have. Thank you so much for joining. That's my email if anyone wants to reach out, and then you can also find me on LinkedIn. Happy to take any questions.
Thank you so much for that wonderful presentation. I know somebody who is about to begin their residency training, which can seem a little daunting. It's really nice to see somebody who is at the end of that and is so successful in that. I wanted to open to any questions if anyone has any. Otherwise, I do have questions I have for Dr. Faith as well. And feel free to send a question in the chat if you don't want to unmute yourself. But I could start with questions. My first question for you was talking about, at the end, you sort of talked about mentors. And I think that is something very daunting, as you kind of alluded to. So how did you find your mentors? I guess who were your mentors and how did you find them?
Yes. So for me, I've had like different mentors which is normal, different mentors at different stages of my career. And I would say like in medical school was essentially just like finding, it was mainly local, right? So it was just people in my medical school, like lecturers that I found, inspiring. And I'm like, oh, you're really smart. How did you do it? How do you do this? And then I just talked to them and developed relationships with them. And I think one really good way that helped me then was getting interested in whatever they're doing. So it was like, oh, I see that you like to do mission trips to so area. I think I would love that too. And like once you volunteer your help, essentially you've gotten yourself into that same space with that person. And then mentorship doesn't have to be like some structured formal, oh, we're talking in this meeting. It's just like by your association with them, you get to ask questions, you get to learn from what they're doing. So for me, essentially it started by just like getting interested in whatever they were doing, volunteering to work on their research projects or volunteering to work on their like pet projects and charities that they volunteered with as well. And then I would say moving forward, when I was trying to, go way beyond my space and way beyond my environment, I essentially just like cold emailed people or like reached out to people on LinkedIn essentially. So I would go to like, programs or just like programs, and then I'll just look at the profiles. And I mean, for me, I was like, okay, maybe I was looking for something to connect on. And at some point, maybe that connection was, oh, this person is Nigerian. So maybe they would talk to me, right? Or this person is interested in global health. Maybe they are going to talk to me. And, essentially, like anybody that is interested in global health, well, let me not say anybody, but most people are also are usually interested in people from other countries, right? Because that's how, they make connections and also like help make impact. So that was really the entry road for me. Like those were the people that I tried to reach out to. And it was really helpful for me to be part of that organization, the Emergency Medicine Interest Group, because it brought some credibility to what I was saying. So it's like, oh, okay, I am the I'm the general secretary of this organization, and we would love to have you talk to like a group of excited medical students that would love to know more about what you do. And then usually what we would do is we'll get them on the call and they'll be like, can you just wait for 5 minutes after? And then we'll ask them a little more questions. And then from there, we were able to meet, I was able to meet quite a few people and then people that I connected with that now provided guidance throughout my journey. And it's also and that tip I will provide is also knowing what to ask. So it's really hard for someone to know exactly what to give you. They don't really know what you want. So you have to get good about kind of defining what you want from them and learning how to ask. And I would do that through emails and even physically, even when I didn't really have a question, but I wanted to make sure that I kept that relationship going. I'll be like, oh, what's your advice for, so and so and so. Like, oh, would you take a look at my CV and give me a recommendation on how I can edit this? And that was something that was also really helpful. So many people looked at my CV and my personal statement. I don't even know how many people I sent it to. I just sent it to everybody. I'm like, please give me pointers on this and pointers on that. And that kind of gets people a little more invested in your journey, a little more, invested in your process. And then when you're successful, they're happy because they feel like they connected with you as well and they kind of helped. So that was my primary way. I really just initiated, like found people that maybe had something in common with me in some way and just reached out to them. And then of course, some people don't reply, but that's okay. Sometimes they can refer you to someone that is more interested in that. I'm like, I don't have time for this, but I have a colleague that might be able to help you. Just don't get afraid to ask and just keep asking. And if someone says no, it's okay. You just keep doing. So that was my way.
Yeah, I think that's really helpful. I think we often feel nervous about reaching out to people. But at the end of the day, worst thing that can happen is that they just don't answer. So I think that's great. And I like the having a specific question for them because I think you're right. Like I feel like I want to reach out to people who I'm interested in being a mentor and I don't really know what I'm looking for from them, but I think just having even an initial question, I think is a great way to start that. So thank you for that. Um, Okay, another question I had for you was, were there any significant barriers you had in advancing your career and how did you navigate those?
Um, yes, I would say, I kind of talked about like one of my biggest barriers was just getting, like coming from Nigeria and getting to the US. That was a big barrier for me because for me that meant different things. It was also a huge financial commitment. And, anybody that has applied knows how much it costs to apply to residencies. So that was a huge financial barrier that I kind of had to like think about how my family was going to support that. I mean, I don't come from a wealthy family by any means. So that was a lot of strain to think about. And then the other thing was just like getting in like some so writing the exam. So USMLE exams are not exams that are part of our medical training, right? So it's like a different exam to study for. So for me, after medical school, and then after medical school, you do like a 1 year. It's kind of like a 1 year internship, which is part of your training. Like you don't get a license until you do that training. So it's essentially part of medical school. But you do that, and it was during that time when I said, okay, I'm going to write this exam. So essentially, I had to take almost like 6 months after like that training and say, I'm just going to study for these exams and try to like get everything ready. So I had to give up a lot of things. So I had to give up making money essentially, because I couldn't combine it with like very intense work. So I had to take, lighter jobs and like focus on like studying for the exams. I had to, and information too was like, the big barrier. So it was like I had to like find communities online where I could get information about how do I write this exam, how do I get it into emergency medicine, what are the requirements, how do I work around the clinical experience, which I never left Nigeria before, and this was the year before. This was the year of COVID, so there was really no way to travel. Like aside from the fact that it's difficult to get a visa to come here anyways. I'm like, and now all the borders are closed. Like, what am I gonna say? I have no experience. I've done no rotations. Um, And then luckily I heard about like, the Oslo where I could do rotations with people in Nigeria and then they would write recommendations about like, my emergency medicine skills. So that was the opportunity that I explored. And then I did like virtual rotations. I was like, I'm just going to find any way possible around this. And if anybody doesn't see, like, even if I don't meet all the requirements, nobody can say that they did not see my passion in trying. So essentially that was my goal. I was like, I was going to like all of the like different barriers, and even research too was a big barrier because when my medical school, like a lot of the people that I worked with were not necessarily big on research. So like I had like maybe I'd worked on like one project, like getting out of medical school, and I knew that that was also experience that I needed. So I started to like jump on all the projects, and like at some point I was like working on like 3 or 4 different things at the same time, just so that I could develop myself to meet the requirements of the place that I wanted to go. So I'll say a lot of information and access was my biggest barrier. But after I realized what I wanted to do, it was not that hard to find the information that I needed. Honestly, I think it was just like starting and figuring out what that was. And then, like I said, once you just reach out to people, even if they don't, mentor you, they can tell you, oh, this is what I know about this process. I might not be able to help you, but here you go. Now you know. And then you're like, okay, and then you take the next step. So those were, I would say, my biggest barriers to advancing. And yeah, and that's how I was able to overcome them.
Oh, thank you. I was saying, we have a couple minutes left. I just want to be respectful of everyone's time. Oh, Julia is raising her hand. Julia, did you have a question?
Yeah, thank you. Thank you, Faith, Dr. Faith, for sharing your story. I really enjoyed you taking us through your journey. I wanted to hear a little bit more about like specifically deciding to do the fellowship in EMS. I'm a little bit a little bit earlier in my journey. I'm a second year studying for my boards now, getting ready for rotations. But I'm pretty undecided in what I want to do, and I just wanted to hear a little bit more about like how you were able to hone in on this specific specialty or just a specific fellowship and maybe like the questions you were asking to figure out, oh, is this going to be the right fit for me? And what were some of the things that you saw in other areas where like, okay, this might not be where my skills would be best utilized, if that makes sense.
Yeah, that does. That's a great question. When I started residency, I think that I was thinking about the things that, made me excited. I mean, I knew that emergency medicine made me excited. Teaching made me excited. So I kind of liked medical education. I was like, I would love to be able to, share my knowledge with people. And then global health was, of course, a big thing for me because I was like, I want to be able to take this emergency medicine knowledge to other places. And then, of course, just kind of like, I think exposure is the first thing. So, like, exposing myself to like different aspects of these things, like, oh, okay, maybe ultrasound sounds fine. Okay, pediatrics is okay, but I don't think I want to do that for the rest of my life, or just kind of thinking through. And then I think, kind of in my second year, I was kind of undecided between whether I was going to do medical education or I was going to do global health or I was going to do like EMS because EMS was not, the funny thing is that EMS was not on my mind when I moved here for residency. Like when I was thinking about fellowships, like after school, I was like, okay, maybe I would do global health or medical education. I think critical care was something I was thinking about as well. But when I came here, I think it was like the first EMS lecture we had. I was just hooked. It just sounded so exciting. I don't know. I was like, this sounds great. And then I went on like a few ambulance rides and I'm like, oh my gosh, this is the emergency of the emergency. Like this is like the, first point of call and this is really fun. Um, and just kind of like thinking through my overall goals, I was like, okay, I was really struggling between which of these three I wanted to do. But I just thought about the fact that, I mean, I wanted to do global health, but I wanted to have a specific way to do global health. And EMS kind of gave me options, I felt like, okay, I could do EMS, which would let me, practice in a different, like I'll be able to practice in the US, as an EMS physician, help with running ambulance companies. I could also take that knowledge and do the global health work I wanted to do in the first place and help them develop their EMS systems. And then EMS is ingrained with education, like, and that was something I learned on my rotation because you're constantly teaching EMTs, you're constantly teaching paramedics, you're essentially teaching the community. And that was actually an area of teaching I really enjoyed. I felt like I loved teaching people that, just wanted to know the basics. I didn't want to like go into all of the like how the pathophysiology or how this cell moves in with that cell. They just wanted to know how can I stop this person from, bleeding? How can I make sure that they breathe? And that was the kind of education I liked and I enjoyed. So like experiencing that rotation, and then in my second year I now did an additional rotation. I was like, I think I'm interested in this EMS, let me do a little bit more. And I had a great I have a great medical director that kind of tailored the rotation to kind of fit some of the things I was interested in. So instead of just doing it at like the large urban EMS system we have here. He is also a medical director from like for like a more rural area of Missouri. So that's where he sent me to, and like I was like kind of in that space to kind of see how it was and do a lot more teaching, and I felt like really it gave me a lot more options and flexibility in my career, which is something that I wanted, and I felt like some of the other options would kind of limit me in a way. And that's kind of how I ended up, just going with EMS. I'm like, I think I can do all the things I want to do with this. And it was something that I made sure to say at all of my interviews. Like I made sure that I was applying to places that also had a huge global health, work involved. So that was a main thing that I was looking for. I was like, I'm doing EMS, but global health is a huge passion of mine. Do you have anybody on faculty that is doing this? Do you have anybody that has both interests? And they were like, oh yeah, we do. I mean, in fact, last week we sent somebody to this country, and I'm like, great, that's why I'm coming here. So just also like making sure that if you can kind of tailor anything to what you want to do. I mean, Dr. Pelletier, who we work with in Techies Without Borders, she did a medical education fellowship and she does a ton of global health work. So it's like whichever fellowship you do, you just kind of like also just think about what you want to do overall and find which one allows you to do that, if that makes sense.
That makes sense. Thank you so much.
Sorry, Mo.
Does anybody else have any other questions? I'll say if not, I just want to say thank you so much, Faith, for this wonderful presentation and for answering the follow-up questions. I definitely feel better moving forward about thinking about career plans and what I want to do. I really liked your talking about, creating your own story. I think that was a really nice way to think about it. So I really appreciated that. For everyone joining, I tossed in the chat a little post-session survey. If you guys would mind filling that out, it's only 5 questions. It just helps us kind of tailor these sessions, make them better for the future. But if no one has any other questions, just want to say thank you so much for joining.
Thank you so much for having me.
Yeah, thank you. All right, take care, everyone.